I want to ease my back pain and avoid pain pills. My name's Jason Hawes. I'm a physical therapist with WellSpan. We're going to talk about getting moving by utilizing physical activity and aerobic exercise in order to help you manage your pain symptoms. So I know what you're thinking, exercise for pain, this guy's crazy. But let's get into, before we get into exercises, let's get into just some of the reasons why that can help. Let's talk opioids versus endorphins. Opioids, we all know, are the painkiller medications that's often prescribed. However, we have our own endorphins, which are our body's natural painkiller to help fight pain for us. So they both block pain signals. They also cause a feeling of euphoria or like a high. You often hear runners, after they're running, they get a runner's high, where that's that sense of that euphoria. The difference is your body can adapt to the presence of opioid medication, meaning you might need more medication in order to get that same feeling of euphoria or that same relief that you get from that medication. So you need to take more and more and more to get that same relief. Opioids also cause your body to decrease its natural production of its endorphins. So it reduces your body's ability to fight pain on its own. I know you're still thinking, but exercise will hurt. As I said, exercise helps release your natural endorphins. It's recommended to do low to moderate intensity of exercise is enough. So what is low to moderate intensity? It's 50 to 60% of effort. So what is 50 to 60% of effort? So if you look at this nice diagram on the left, you want to start, when you're starting out an exercise program, you want to start, I'm still comfortable, but I'm breathing a bit harder. That's probably where you want to start. After that, you want to get into, maybe you're sweating a little, you're still comfortable, feeling good, but you can still hold a normal conversation without too much effort. As you start getting more and more into it and you start feeling better, you can start going into the yellow a little bit, where you're feeling a little bit more comfortable, you're starting to get a little bit of a sweat, but you can still talk easily. The take-homes here, some movement is better than no movement. So, just like some money is better than no money. So we don't want you doing nothing, but doing some of it will help. The other take-home is don't avoid exercise during a flare-up. So it's often very easy, you get a little sore from as you start a new exercise program, to stop doing anything. You think about the New Year's resolutions, everyone has good intentions. January 2nd, they go to the gym, they get their gym membership, they do every piece of equipment that first day, they get sore, they never go back. So the key here is do not stop, but maybe just slow down. You might have did too much too fast. That soreness or that flare-up isn't necessarily causing harm, it's just your body's way of reacting to doing a new activity that you're not used to, or you might have just done it too quickly. So it's just going over some general benefits of exercise. Keeps your joints moving well, keeps muscles strong. Stronger muscles means better stability and more stability for your joints. Helps with anxiety and depression. You start moving better, you start feeling better. Weight management, anytime less weight is always less stress on our joints. Helps you sleep better. You start burning more calories, you start burning more energy, you will actually sleep better. And last, improve your confidence. So you start moving better, you start feeling better, so you start doing more of those activities at home. Maybe start doing those things that you haven't done in a while that you really used to enjoy doing, so you start getting more confidence in doing those things. And not on this list is just the general benefits of exercise as far as with managing other health risks, such as high blood pressure, osteoporosis, diabetes, and cardiovascular disease. So as I said, strengthening can help. If you look at the spine, you look at the different muscles around it, that's what we're going to try to strengthen, because that's what's going to kind of almost give our spine its stability it needs, by strengthening those muscles. So what happens to your spine with pain? So a lot of things go on when you start having pain. You start kind of walking around slouch, as you can see in the picture. So you generally adopt poor posture. So when you adopt poor posture, whether you're slouched or you're kind of overcorrected, or you're leaning to one side or the other, you're overstretching ligaments, you may be causing more irritation than help when you do that. Also affects the way your muscles react. They may not respond as quickly as you would like them when you need them. You also might compensate and perform different movement patterns, which might cause more irritation as well. And thus that just leads you to having difficulty maintaining what we call a neutral spine, or keeping your spine more in better alignment most parts of the day. So just to kind of go over some of those exercises. So the first exercise, what you would do is strengthen your transverse abdominis. So it's important to kind of know how you're doing that. So if you find your pelvic bone or your hip bone, some people call it, you would go 1 inch in, 1 inch down. And that way you can feel that muscle activate as you tighten it. So you would tighten it and make it nice and firm. You don't really want to blow out, like you're trying to be Santa Claus or look like you're pregnant or anything like that. And you don't really want to suck in like you're trying to squeeze in some tight jeans. You want to just make it nice and tight. So if you put your finger there, you would feel that tighten up and you'd feel that firm up underneath your fingers. You want to hold that for about 5 seconds, and you can do probably 10 to 20, one time a day or even up to a few times a day as you start getting rolling. So a progression to that, or to make it a little harder, obviously we said we want you to be able to use these muscles when you're moving and keep that neutral spine when you're moving around. So we're going to start adding some movements to it, which will make it a little harder to keep that neutral spine and keep it working. So what you do is you do the same tightening as you do in this one here. And what you do is you would just be marching as you're keeping that tight. You can use your hands there again to feel just make sure you're keeping that contraction the whole time. And in the picture, it's doing it lying down, but you can do it sitting or you can do it standing like I just did. It doesn't matter. You don't have to do it lying down. As you start getting better with that, you can start adding just more of what was like a straight leg raise. That will make it a little bit harder to maintain that contraction or that tightening of your stomach as you're doing it. So you would just lift your leg up as you keep it tight. You can do one leg at a time or you can alternate. That's really up to your preference. Alternating would probably be harder because it would require you to maintain that contraction as you shift your weight from one leg to the other. And last is, as those get better, you can get into what we call bridge. So what you would want to do is you want to lift your bottom up off the bed. You don't necessarily need to go as high as this young lady is in the picture, but just getting your bottom off the bed is a good start. You want to hold that for probably about 3 to 5 seconds. You can do 10 to 20 of those. Again, one time a day or up to 3 times a day or more if you feel you're responding pretty well to it. And then the next series, these are a little bit harder. So you'd want to get on all fours. You're going to do that same tightening as we've started the very first exercise. You want to keep your back nice and flat like they have in the picture. So sometimes with patients, I will put like a tissue box, something that won't necessarily break or anything, but I'll put that on there so that way when they do that alternating motion, they're not compensating or moving. They're keeping that neutral spine. So if that falls off, box falls off, then you know you're keeping a nice flat spine. And then you can progress into doing the leg kick. Same thing, keep the back nice and flat. You would just alternate kicking back your right leg, left leg, keeping your back nice and flat. Again, you can do 10 to 20 of either of these and up to one time to a few times a day if you feel up to it. And the last one, this one's probably the most challenging one that's up here. I would recommend if you do this one to do it either on the floor if you can get on the floor or try to move to the center of the bed so if you do lose your balance, you don't injure yourself trying to help yourself. Again, keeping your back nice and flat, so you would lift in this case, she's lifting her left arm and her right leg's going back. You'd bring that down slowly and then you would reverse and just repeat. And that one you might want to start off with about 5, but you can do up to 5 to 20, again, one time a day to up to a few times a day if you feel up to it. I want to thank you for your attention. If you would like to learn more about the exercises or anything from our spine team, please feel free to give this number a call, ask for one of our nurse navigators. Thank you.